All right, YouTube, welcome. In this video, we're going to talk about what is Gestalt therapy. Gestalt therapy is grounded in a rich theoretical framework that integrates ideas from phenomenology, field theory, and a deep belief in human agency. At its heart, it proposes that the way we experience reality is structured by our perception, by the whole configuration or gestalts that we form out of our sensory and emotional data. Rather than seeing the mind as a container of fixed parts or unconscious drives, like maybe psychoanalysis, Gestalt theory views the person as an active process, always organizing, interpreting, and shaping experience within a field of relationships. The key idea here is that meaning is not hidden beneath behavior, but it's revealed through how we make contact with the world and how we direct our attention, how we complete or interrupt the natural cycles of needs, awareness, and action. This therapy builds on the Gestalt psychological insight that we perceive wholes before we perceive parts. And this translates directly into its clinical philosophy. The goal is not to break people down into categories or fragments, but it's rather to understand the entire patterns and tensions that make up their whole experience. The concept of unfinished business, for example, reflects how past experiences that were not fully processed can linger on as incomplete gestalts, and they often distort the current perception and behavior of that individual. So when those unresolved patterns, the unfinished business, are brought into awareness, the person then has a chance to reorganize them, often through embodied or experiential techniques, which allow these old configurations to reach closure and resolution. Another central concept to Gestalt therapy is the idea of contact boundary. This is the edge where the self meets the environment, where experience becomes meaningful through interaction. Health, from a Gestalt perspective, depends on being flexible, and it is related to the creative contact with the world. So being able to assert oneself, being able to adapt, withdraw, or engage as needed. Neurosis, by contrast, is seen as a certain rigidity in these contact processes. People become stuck in habitual ways of organizing their experience, often out of fear or historical adaptation, and they begin to avoid the discomfort that comes with authentic contact with the world. This is where Gestalt therapy does its work, not by interpreting from above, but inviting the client into a deeper awareness of how they are interrupting themselves, how they're shaping their world, and how they might do it differently. The therapist in Gestalt therapy does not diagnose from a distance. They position themselves within the field as a co-experiencer, a co-creator with the client, both influencing and being influenced by the client. The relationship becomes a living system in which patterns of avoidance, resistance, or projection can be observed in real time. And the therapist might point out contradictions between a client's words and their gestures, or a therapist might draw attention to subtle shifts in posture or tone. These observations are not meant to be pathologizing, but they're supposed to be integrative. They're supposed to bring the client into a deeper sense of awareness of what they're doing. The ultimate aim is not adjustment or symptom reduction, but true integration into a more holistic gestalt. Gestalt theory insists that when awareness is supported, change follows naturally, not just through willpower, but through the restoration of the person's own experiential intelligence. So this orientation resists reduction. It does not lend itself easy to step-by-step methods because it believes that each person's process is unique and always unfolding and emerging. The theory is dynamic, alive, and it demands presence from both the client and the therapist. In an era where many therapies aim to regulate, correct, or normalize, Gestalt remains committed to something a little bit more radical: the real actualization of human experience through contact, awareness, and choice.